Hey, so good morning, Glenn. How are you?
Yeah, great. Yeah, for a morning, for
For
a
a
Monday
morning?
morning.
Fantastic. Hey, look, just here to interview Glenn White. He is a practitioner in Auckland with the Buteyko method, which is a form of breathing. Some may call it an alternative breathing, although I'm sure Glenn's going to explain more that it's actually how we should really be breathing. And so, good morning, Glenn. Would you like to tell us a little bit about yourself, and then we'll chat a little bit about the Buteyko method?
Yes, sure, Simon. And even before we start, I love the way you called it alternative breathing because I've always considered breathing fairly mainstream. And yeah, what we're really doing is helping people realize what, healthy breathing is all about. Now, my background to it is that I had asthma for 40 years.
Mm.
Not asthma, but hay fever, sinus. I used to get panic attacks. And I just went round down the conventional route managing my asthma with medications and avoiding triggers, and it got worse. And it was at the age, my early 40s, it really deteriorated, and I was in and out of hospital. And it was that experience that actually led me to research a little bit more until I actually discovered this breathing technique called Buteyko.
Mm.
And I finally managed to do a course in UK in 2000, and literally I was, within 5 sessions, my asthma symptoms were gone.
Wow.
Yeah, and within 6 weeks, I was able to come off my medication, and I've been.
And it wasn't a coincidence, obviously. I mean,
Oh
you'd
no,
suffered from those problems
we're
for
talking about.
most of your life.
I had tried everything at that point. I mean, I even I even went to Sicily for a month thinking that the dry air would improve the asthma, but it actually made it worse.
Oh, really?
Yeah, and I won't tell you all the things I'd tried, but like I'd been to the best physicians in London and specialists, and all they could offer me was more medication.
Mm.
Um, so no, it was quite a turnaround, and so we're talking 14 years ago now, and I've been asthma and drug-free in 14 years. So that's what really led me down this path to
Right.
teach this method.
Okay. And so the Buteyko method is essentially it's a way of breathing, and that may sound really strange to people who aren't familiar with it, but it's important. I'd like you to explain more about why the way that we breathe now is perhaps a little bit out of line with how our body should really be working, and there's many different aspects of health where we could draw that same conclusion, and I guess keeping it simple but not too oversimplifying it. I mean, the mouth is for eating, and the nose is for breathing, and there's a lot of processes which the nasal passage actually provide air obviously for the lungs, but there's a lot of things which actually happen within that passageway which are bypassed when you're predominantly breathing through the mouth. And the mouth obviously is a way to get air into your lungs, but when you are over breathing in that particular way, you are missing out a lot of processes which are required for basic health. Nitric acid and obviously filtering and all those sorts of things, humidity, warming. Can you sort of expand on that a little bit and tell us why it's really important to get back to breathing through the nose, over breathing through the mouth, and why that is beneficial to someone's health, particularly those who are suffering from airway problems like asthma and what have you?
Well, you've done a pretty good job.
Oh, okay.
Not a bad start.
Yeah.
Yeah, so look, just as there are body norms, like, there's a correct body temperature, there's an optimum blood pH and blood pressure, there are breathing norms. And the breathing norms are to be breathing about 4 or 5 litres of air a minute, and that's about 8 to 10 breaths.
That's at rest?
Yep. 8 to 10 breaths a minute. And it's about breathing from the belly, so diaphragmatic breathing, and it's breathing nasally, as you said. Now, the importance for breathing nasally is that, as you also indicated, that the nose warms, filters, moisturizes, and disinfects the air before it gets to the lungs. So now people who don't breathe that way are more likely to get colds and flu. Now, if you're a susceptible individual and you breathe through your mouth, which we are not supposed to do, you can develop conditions like asthma, hay fever, even high blood pressure. Now, the other thing that a lot of people may not consider is the fact that if you breathe through your mouth, it dries out the gums, and it can lead to gum disease and dental decay.
Right. So that's another.
Dentists will yeah, well, see, dentists will tell you that their best, or I should say their worst clients, but for the dentist, the best clients are the worst mouth breathers.
Right.
Ask any dentist and they will tell you this. Now, there's even more implications here, because if you are mouth breathing from childhood, the problem here is that your tongue is in the floor of your mouth instead of in the roof of your mouth, and the face can narrow, and that causes a narrowing of the jaw and crowding of the teeth.
Right.
And of course narrowing of the whole airway, which further exacerbates the problem, because it will also narrow the nasal passages, making it even harder to breathe through the nose. So it sort of comes full circle.
Yeah.
So for people who have been habitually mouth breathing from childhood, they can develop things like sinus problems, hay fever, asthma, sleep disorders like snoring and sleep apnea. And it's important to know that anyone who snores is over-breathing. This is not just a social issue, this is a health hazard. Many studies now showing the higher incidence of heart attack, cardiovascular risk, stroke and heart attack risk in loud snorers, and plaque formation in the arteries of loud snorers. And this is a real health issue.
Right. And you mentioned that from childhood we tend to breathe through the mouth. Do you have any reasons for that? Because a lot of things we do instinctively, and a lot of things, are behavioural patterns and learned patterns. Do you have any thoughts around why? Because again, for a lot of listeners, they're sort of wondering, well, I just breathe the way I do. No one's ever taught me to breathe, and that could sound quite silly. But do you have any reasons why we have kind of ultimately learned to breathe through the mouth rather than breathing through the nose? Because I know back in my my very athletic days, and I'm still quite athletic now, but back when I was training at the gym quite a lot, I was kind of told to breathe through the mouth. That's an example for me where I was told specifically to breathe through the mouth because that's good oxygen supply and all sorts of things. But the truth is actually quite different. So can you explain that a little bit?
Yeah, it's well, for one thing, all babies are generally nasal breathers because they couldn't breastfeed unless they nasal breathe. So
True.
If you look at a newborn, you'll see nasal breathing and you'll see diaphragmatic breathing. Now the pattern starts to change from about 18 months. We start to see a shift, and it's essentially we're living in a society of mouth breathers and over breathers. It's the stresses of modern life. Now, an interesting fact here that if we look at records of what they call breathing norms or minute volumes. So in recent times, people were breathing pretty well the norm right through the last Depression and the First and Second World War.
Right.
Now those were pretty stressful times, but we have to have a explanation for why breathing rates are now double what they were 50 years ago. Now the difference is that during the Depression, First and Second World War, there were food rations, there were fuel rations, and people were just eating less and moving a lot. And so the real, problems, if you like, for breathing are things like sedentary behaviour, overeating, eating the wrong kinds of foods, high in refined carbohydrates. All of these things contribute to push breathing rates up. And if you've got a whole society that's over-breathing, of course, children are mimics, and so they learn it from their parents.
Right. So it's like a semi-instinctual thing. It's something that we kind of observe, and that kind of over years creates those patterns.
People often ask me, for example, if I can... See, we work with children from about 4 and up, but I often get inquiries for parents of children who are younger than 4, and they say, what can we do? And I usually work with the parent, because the child is picking up the breathing habit from the parent.
Oh, very good.
Yeah.
Okay.
So you work with mother, and then the child will more likely follow that role model to a better stage of breathing. Then we can work with that child, when they're old enough.
Right.
Need be.
And you mentioned also, a couple of times I've heard you say diaphragmatic breathing. Perhaps you could open that up, because I'm also aware that diaphragmatic breathing is very key in those people who are suffer from anxiety, and if you go to most psychologists, they'll tell you, when you're suffering from some sort of anxiety episode, that can be, alleviated a lot by diaphragmatically breathing, because like asthma, I guess it's the panic situation, isn't it, where you tend to hyperventilate, and then that actually exacerbates the problem. Your body kind of goes into a primal state of breathing, I guess, to oxygenate blood, perhaps, for the having to run away from the lion, so to speak. But of course that situation doesn't occur when you're anxious about a financial situation or a work stress or a relationship stress. And so can you talk a little bit about the diaphragmatic breathing and the over breathing factor in terms of the hyperventilation?
Yeah, sure. Yeah, as you pointed out, stresses are supposed to be taken standing up, and they're supposed to be short duration, but a lot of us take our stresses sitting down.
Yeah.
And of course, if a stress is prolonged, then the over-breathing that goes along with the stressful event becomes habitual. So we've got that running in the background. Now, if something triggers a hyperventilation attack, a panic attack, or an anxiety attack, whatever you want to call it, this causes a temporary increase in the breathing, which paradoxically, it's the opposite of what people would think. It actually starves the brain of oxygen, and this initiates adrenaline production from the adrenal glands. Now, in these circumstances, what generally happens is the diaphragm kind of locks in the upward position, and all the breathing goes into the upper chest. And usually that person is also mouth breathing as well. So possibly not the easiest thing to do without coaching, but we always say to people, if you're stressed, the best thing you can do is try to get your breathing down into the belly, breathe diaphragmatically. And one very quick tip we will give people in that situation is to cup their hands over the mouth and nose and try to breathe into the cupped hands. This just helps to raise the carbon dioxide levels in the blood and can have a calming effect overall. You might know, you've heard of the old paper bag, breathing into the paper bag.
That was the thought in my mind when you spoke of that, yeah.
Yeah, so it's on that basis. In the clinic, we teach people a breathing exercise to breathe their way out of that, but more importantly, we're teaching them new breathing patterns that will restore a healthy, normalised breathing pattern so that those panic attacks don't occur.
And carbon dioxide isn't the enemy either, is it? I mean, it's not a nutrient as such, but it's an essential gaseous component of blood pressure norms and everything, isn't it? You mentioned blood pressure before.
That's the reason we're supposed to nasal breathe, and that's the reason we have lungs. One of the primary functions of the lungs are to maintain a residual level of carbon dioxide in the outgoing breath. And carbon dioxide is a muscle relaxant, and it facilitates the release of oxygen into the cells of the body. It's absolutely vital.
Yes. And I guess someone who's, and we deal a lot with people who are detoxifying, and detoxification, rather the lungs are a key organ to facilitate to facilitate detoxification because of the gaseous exchange. And so carbon dioxide not being one of the gases which brings that out, but it's all part of that whole process, isn't it? I mean, if you are breathing properly, then you are going to be facilitating that part of that organ's detoxification process, as well as just normal, healthy breathing.
Yeah, no, you raise a really interesting point that in actual fact, essential, good, healthy breathing is vital for detoxification, and it's the opposite of what most people would think. By gentle breathing, often for many people, that come to our clinic, we have to get their breathing down to half of what they're breathing. They're breathing enough for 2 or 3 people.
Wow. Which is fine for the athlete, I suppose.
Well, no, it's not. No. The same thing. We work with a lot of elite athletes for the same reason, that their cardiovascular and respiratory efficiency is increased by breathing less, not more. Most people can benefit from learning to breathe a lot less, and even for athletes, even learning to breathe through their nose, even during quite intense cardiovascular activity.
Right.
Quite high levels of effort. Now, one point about the detoxification is that when you If the carbon dioxide levels are at the right level in the blood, it facilitates the release of oxygen into cells, and cells can only do function and detoxify if they're receiving adequate oxygen. By overbreathing, it starves the cells of oxygen, and detoxification is inhibited.
Right. Could I draw a similar parallel with altitude training for athletes by correcting athletes their breathing techniques, just as any normal person in society that's got respiratory issues, asthma, etc., or even just any normal person that can benefit from learning to breathe properly. An athlete who is taught to breathe predominantly through, or almost exclusively nasally, is that similar in a way to altitude training? How athletes are able to get better, oxygen, better oxygenated blood is what I'm trying to say. Can I draw a similar parallel there?
Yeah, and you're probably familiar with some of these devices that mimic effects of high altitude, but what they're really doing is by, when you go to altitude, you're taking an oxygen, poor environment, and it boosts hemoglobin production. So what that's essentially doing is boosting the oxygen carrying capacity of the blood. So no, it's a little bit different than that. But it's an interesting point you raise, because anyone who's considering any altitude work would do very well to do this program. And one of the earliest clients I taught was a guy who used Buteyko to climb Everest without oxygen successfully.
Wow.
And he did that without doing any altitude training. It's all about improving that respiratory and cardiovascular efficiency.
Yeah, because a lot of, we work with health, obviously, and it's amazing the kind of default norms which we have, which people kind of expect is the normality for things, and then someone hears of the Buteyko method and speaks to you for more than 10 minutes, and it's like a light bulb that goes on, and it's something so simple as breathing can completely change their life. Again, especially for those people who aren't well. So you've seen thousands of patients. Do they have continued success? Do you sort of monitor them afterwards, or do they come back for further training?
Yes.
Or?
Yeah, we do, and we keep in touch with our clients. I'm in touch with the very first client I taught way back in 2001.
Wow.
So and we've seen, at last count it was about 6.5, must be close to over 7,000 people now.
Yeah.
And we get great feedback, and we help people with such a range of disorders. And I guess the brief expanded from when I first started, because naturally my focus was asthma. But the more I researched and the more work I did and the more people I worked with, I found that breathing is fundamental to everything, really. And we often say to people, if you've tried everything and you haven't had success, come and see us, because it's very likely your breathing is at fault. The obvious ones are things like nasal congestion, asthma, hay fever, and allergies. But maybe the less obvious ones may be snoring and sleep apnea, hypertension, migraines, stress disorders like panic attacks, even chronic conditions like emphysema. We can help people get so much more out of life by learning to breathe more correctly.
Yeah. Oh, that's great. Well, I guess we could probably, like most things, carry on for a long, long time. But we've got a lot of sort of fundamental things there, don't we? Anyone that's got some compromised, either recognised breathing issue, or, like you say before, something that's you wouldn't even expect to come under that umbrella of improved breathing may help them with. It'd be a good idea just to get in touch, or they can obviously research on the net. There's your website that's got a bunch of questions and answers on there and everything. And is this something that can sort of is this something that can sort of be learned by people sort of reading a little bit about Buteyko to sort of get some improvements and then find, oh wow, that worked for me, and I'm going to go and learn it properly from a practitioner? Or is that?
Yeah, well, look, there's a couple of things there. First, I thought for your listeners, I'd leave them a few hot breathing tips to get started with.
Great.
Before I do that, just to let them know that, you know, our clinic's in Freeman's Bay, and if anyone wants to call us to find out more about the programs, the Auckland number is 09360 6291. And we also, our website is, well, actually you'll probably have that on your web.
Yeah, we can add that in there for sure.
Yeah, it's a bit of a mouthful, but we have practitioners, you know, throughout New Zealand and Queenstown. We have practitioners here in Auckland, down in Pukekohe in South Auckland, and we are doing courses in Wellington too. So, you know, there's plenty available throughout the country. But look, I thought I'd leave you with a few breathing tips, and you know, if people, you know, try some of these, even a few of these tips, they should notice some improvements. So the first thing is keep that mouth closed and keep those lips gently together at all times, except when you're eating, drinking and talking, as you said at the start of the interview. Now the other thing is to breathe through the nose at all times, even during strenuous activities, whether that's walking upstairs or even going for a jog. And if you can't stop, slow down. If you're on a bike and you go up a hill and you can't do it, get off and walk it. It's that important.
So your breathing can kind of more, your breathing can kind of more give you an idea of how you should be exercising until your fitness kind of increases to catch up with your breathing. Is that what you're saying?
Well, your breathing fitness catching up with your overall fitness. So, for example, if you're in a spin class and you're going hard out, but your sweat's pouring off you and your mouth's wide open, you're probably not doing yourself a lot of good.
Yeah. And
those are the kind of people that should come and see us, because we can help you get the most out of those activities. You need to.
And improved health too, because of those things that we mentioned earlier on in terms of the humidity, the warming and the filtering process which go on.
Well, for an athlete, it's just cardiovascular efficiency. If they're breathing nasally and if they're breathing optimally, they'll get more oxygen to muscle tissue than if they've got their mouth hanging open. Yeah. And one of the interesting things we do with athletes is when you get an athlete, I'll take the elite athletes and I'll do a before and after test. And you'll notice things like water consumption go down, sweat reduces, and of course their performance always goes up in the end.
Great.
It's quite dramatic. Okay, now the other thing is, you could also, you know, the other thing is just things like yawns, sighs, gasps, or coughs. Just try to avoid a cough if you can, you know, stifle a yawn if you can. I know that sounds strange, but these are
why is that?
Well, it's because you're leaking carbon dioxide, and remember I said carbon dioxide is that, you know, wonderful muscle relaxant, and the more carbon dioxide you leak, the less oxygen gets to your brain and your body tissues.
Of course.
So, yeah, it's, it does sound counterintuitive, but, you know, if those simple steps, if people can just start thinking about those, they're already making a significant shift in their breathing pattern and their health.
Awesome. That's fantastic. Well, look, thank you very much, Glenn. It's been awesome to talk to you, and there's some really good, great tips at the end, but also some really good knowledge, which is, you know, very straightforward. I think for a lot of people just to even to ponder on and think, and they can go and do perhaps their own research into, you know, what we've been talking about, and hopefully a lot of people who will be listening to this will give it a go, because it really is. You know, something that can benefit even someone who's even in really good health at the moment, you know, like for example the athletes that you spoke of, you know, to get increased performance and such like. So so thank you very much for your time, Glenn, and I think we'll have to schedule another chat in sometime in the future, and perhaps sort of extrapolate, you know, on a few of those points a little bit more for some of those people who like to get a little bit more nitty-gritty about, you know, how those sort of processes work.
Yeah, no, it's always difficult for me to sort of get anything into, you know, into 15 minutes or so.
Yeah.
It's a huge subject, and honestly, it's a life-changing program. So,
yeah.
Always thank you for the opportunity to, you know, give you a little insight.
Yeah, of course. Yeah, and we'll have this up sometime really soon, and we'll make sure your web address and everything's on there so people can get in contact with you directly.
Okay. Well,
awesome.
Enjoy the rest of your day, Simon.
I certainly will. Thank you very much, Glenn.
Cheers.
Okay, bye-bye.